Well, lacunar stroke is a very particular type of stroke, subtype of stroke, and we can divide the approaches to acute stroke treatment and the secondary prevention. The acute stroke treatment for lacunar stroke is basically IV thrombolysis, which is, has been established in 30 years or so, and we have reasonable data that show that thrombolysis is effective and also safe in patients with lacunar strokes. Well, secondary prevention, there are more conflicting data because single antiplatelet therapy may be reasonable in patients with lacunar stroke. There is probably a lacune in secondary prevention for lacunar stroke because we don't have enough evidence to perform a double antiplatelet therapy for short term. We know for certain that for a long term, double antiplatelet therapy is dangerous in lacunar stroke because in patients with small vessel disease as lacunar stroke, there is an increased risk of bleeding and intracerebral transformation. And this has been demonstrated in a clinical trial. But we lack probably evidence for the short term, 3 weeks after stroke for double antiplatelet therapy specifically targeted for lacunar stroke. This is one of the hot points because, for example, in lacunar stroke, we don't know how to administer and when to administer double antiplatelet therapy. We don't know if this is effective, if this is safe for such categories of patients. There is also a category of patients with lacunar stroke that deteriorate. Basically, there is a worsening in the neurological deficits, and the evidence about the treatment to administer in such patient is very low. We can do double antiplatelet therapy in this patient for 5 days, but we just only have retrospective data and low quality data.